All right, welcome back. Today we're continuing our review of our third BCBA practice exam, where we're going through the next 10 questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe. If you're looking for this exam plus our other two practice exams, please check out bcbastudy.com. We offer 3 full practice exams, a task list study guide, and our combo pack, which includes flashcards. It's our best deal. If you're looking for questions or comments, please let me know. I'd love to help. As always, work hard, study hard. Let's get to our questions. When determining what behaviors and skills we should target, we should focus first on what aspect of the intervention outcome. What do we prioritize? What does our ethical code say? What does our task list say? What do we prioritize in treatment above all else? Always prioritize the client. The ethical code says it several times. It's in the task list. We have to prioritize the client. So when we talk about outcomes, it's very important that we consider the client plus stakeholders. But ultimately, what are we trying to change? We're trying to change the client's behavior in the client's life. Let's look at our answers. A, how the outcome will affect the parent's life. While important and while the parents are a crucial part of treatment, it isn't the first aspect of what the intervention should focus on. Just because a behavior is annoying and it annoys the parents doesn't mean we should change it to better the parent's life if that behavior isn't, let's say, atypical or impacting the client in a negative way. What about B, the social validity of the outcome? Well, absolutely, right? We're looking for socially valid behaviors, behaviors that are meaningful to society, to the client, to the people around the client. So when we say socially valid, we're really talking about all-encompassing stakes for a behavior change. It's really our focus when looking at intervention. What about C? What the client's teachers will think about the outcome? Surely that's not going to be our first thing we consider when we're changing behavior. And then D, only the client's opinion should matter when thinking about the outcome. Does the client's opinion matter? Yes. Are they involved in treatment? Yes. Is it the only thing that matters? Of course not, right? Ultimately, you're the BCBA. You need to use your best judgment, your skills, your experience to make the right call. So what aspect are we first thinking about when designing intervention? It's going to be B, the social validity of the outcome. During training, RBTs get in groups of 2. One RBT acts as a client and the other RBT delivers DTT. You ask the RBTs to deliver reinforcement quicker once the response is observed. What are you concerned with? What is the question asking about? The question is asking about the part where you ask the RBTs to deliver reinforcement quicker once the response is observed. Now, why is that important? Well, the quicker we can deliver reinforcement once the response is observed, the closer that reinforcement will be to the response, the more effective or the better chance the reinforcement will be effective at changing that behavior. Closeness of reinforcement to target behavior is imperative. So if we need our RBTs to deliver reinforcement quicker, we need it to deliver closer to when that behavior is actually exhibited. So what are we concerned with? Are we concerned with the magnitude of reinforcement, the amount, or the intensity? Not necessarily, right? We're thinking about speed here, and closeness. What about topography? Again, it can look however the reinforcement looks. It doesn't really matter. We just want to deliver it quicker and closer to our desired response. So what we're looking at is contiguity. And contiguity implies or represents the closeness of our reinforcement to the response once that response is observed. We're not necessarily looking at rate, okay? Yes, you could technically say you could increase rate, right, and make it quicker, but rate can also go the other way, right? We could also slow it down. So it's not really the rate of reinforcement. We're looking at the closeness of reinforcement. Joanna is working with her client at the table using the DTT teaching procedure. Joanna says to her client, which one is a tiger? And the client says, elephant. What type of verbal behavior is this? Use this question, which is fairly easy, as a thought exercise. Let's think about when we're talking about verbal behavior, what are we talking about? We're talking about verbal operants. And when we think about verbal operants, what do we need to know for our exam? We need to know what evokes, what reinforces, is there point-to-point correspondence, and is there formal similarity for our verbal operant? If we know those 4 things, we'll never miss a verbal operant question, I guarantee you. In this case, Joanna's working with her client. Joanna says to her client, which one is the tiger? And the client says, elephant. What is evoking the verbal behavior from our client? Well, Joanna's saying to her client which one is tiger, therefore it's a verbal SD. Is there point-to-point correspondence? Is the thing being communicated exactly the same between the speaker and the listener? It's not. Joanna says which one is the tiger, the client says elephant. There is no point-to-point correspondence. Is there a formal similarity? Well, Joanna says, client says, there's absolutely formal similarity there. The type of communication or the form of communication is identical. So we have evoked by a verbal SD, no point-to-point correspondence with formal similarity, going to be reinforced socially, which we don't know, but we can predict based on the type of verbal operant we have. What is that? Is that attacked? Well, attacked is evoked by a nonverbal SD. Listener behavior is receptive instructions. The client isn't following instructions. And echoic has point-to-point correspondence. This does not. So it has to be an interverbal. If you approach verbal operant questions that way, you'll never miss one. This type of measurement tends to overestimate behavior. Now, when we talk about overestimating or underestimating behavior, what type of measurement are we talking about? Are we talking about continuous or discontinuous? Well, we're typically talking about discontinuous. If you're doing continuous measurement right, you should never overestimate or underestimate behavior, considering you are watching and seeing and measuring every instance of behavior. The reason discontinuous measurement can overestimate or underestimate is because we're only measuring in brief intervals. We're taking a small sample of the bigger picture. Now, that being said, what can we eliminate? We can eliminate rate and latency, which are continuous measurements, leaving us with partial and whole interval. So let's think about how both of these are done. Let's assume we have 10-second intervals, 10 intervals apiece. Partial interval, how long does that behavior need to occur? 1 second, right? If it occurs for 1 second in our intervals, we count it. Now, with partial interval, if we have 10 intervals and that behavior occurs for 1 second each, how long does that behavior occur total? Just 10 seconds. So if we look at our data, it's going to look like that behavior occurred constantly, given that we're going to record a response for all 10 intervals, when in reality, it really didn't occur that much. We're really overestimating how often that behavior occurred. Whole interval is exactly the opposite. If we have 10 intervals of 10 seconds each, that behavior has to occur for 10 seconds each interval to count. Now, if it occurs for 9 seconds each, and we look at our data, it's going to seem like that behavior didn't occur at all, when in reality, it occurred quite often more than our partial interval measurement. Whole interval is going to underestimate behavior. What type of measurement tends to overestimate? Partial interval. Think about it from a technical standpoint and conceptually, how do we conduct this measurement and why would it lead to overestimation or underestimation of behavior? As a business owner, you make sure you obtain consent from all your clients so that you can use pictures of them on your social media accounts. Obtaining this consent gives you the right to do what in regards to social media? Okay. Social media questions. Ethics is very clear on social media at this point because social media is such a big part of our lives and it's such a big threat to client privacy. What do we know? We know we've obtained consent from clients so you can use pictures on your social media accounts. Now, what social media accounts are you free to use these pictures on? Because just because you have consent doesn't mean you can do whatever you want with their personal pictures or their personal videos or even videos taken at your business, right? If you have consent that you want to use their pictures, can we post it on professional accounts? Well, we can with the caveat. What about personal accounts? Absolutely not. We can never, ever post client pictures or videos or any media on personal social media accounts, regardless of the consent form. So A, you can post images of clients on both professional and personal social media accounts is incorrect. We can eliminate A. Or D, you can post images of clients on both professional and personal social media accounts with a disclaimer. Again, never, ever on personal social media accounts. So we have to look at C and D. With C, you can post images of your clients on your professional account, or you can post images of clients on your professional account with a disclaimer. Do we need a disclaimer? We absolutely do, okay? Number one goal here, protect the dignity, the interest, the rights, and the privacy of our clients, even if we have consent for our professional or business accounts. Glenda observes her client who frequently hits himself in the chest with a closed fist. Glenda wants to intervene immediately, so she tells the RBT to wrap her arms around the client, which stops him from hitting himself. This type of intervention is known as blank. This question is here to teach you the difference between extinction and response blocking. Common misconception is that response blocking is extinction. Why is response blocking not extinction? Well, let's look at our question. Glenda wants to intervene, so the RBT wraps her arms around the client, which stops him from hitting himself. We're preventing this response from occurring. We're blocking this response from occurring. In order to implement extinction, what do we need to do? We need to withhold reinforcement in the presence of a response. So if you block a response from occurring, can you withhold reinforcement? No, you can't. That response has to occur if you hope to withhold reinforcement. If you're going to block the responses, you can't possibly deliver or produce extinction. So if we are wrapping our arms around the client, stopping the response from occurring, stopping the client from hitting himself, we are response blocking. We are not putting that behavior on extinction. After an assessment, you learn that a client is prone to prompt dependency based on history of ABA treatment. What prompting procedure would most likely be best to use in this case? What do we know about history of clients? We know we need to review history at the onset of a case, including medical, behavioral, therapy. Any history we have is important. It should help our intervention. It should shape our intervention. It should guide our intervention. If we know in the past a client didn't respond well to a medication, didn't respond well to a certain sort of intervention, well, we might work our best to avoid that type of thing. In this case, the history says our client is prompt dependent. Well, that's fantastic information to know when we start designing our prompt procedures. If we know they're prompt dependent, what are we going to try to avoid? We're going to try to avoid invasive, over-intrusive, elongated prompts. So what prompting procedure would most likely be best to use in this case? A, most to least. Well, why would we avoid most to least? Well, most to least, we're going to use the most intrusive prompt first. That doesn't make sense if the client is prone to prompt dependency. You might just cause more issues than you mean to. Least to most, however, helps avoid prompt dependency because we're going to try our best to use the least amount of intrusive prompts as possible and be sure and remove them as quickly as possible. Graduated guidance, although we do remove the prompt as quickly as possible when we use graduated guidance, it is still physical prompting, making it the most intrusive prompt. And then modeling is one step below physical prompting. It's much more informed. Okay, it's a much more informed decision to use a least to most prompting procedure, trying to start below things like graduated guidance and modeling, then immediately jump to these very intrusive prompts, which can ultimately lead to prompt dependency. Which of the following would be considered an antecedent intervention? What do we know about antecedent interventions? We know antecedent interventions occur before the response happens. Now, let's learn, right? So if we look at our answer choices, we have positive reinforcement, non-contingent reinforcement, corrective feedback, negative punishment. On the surface, these might all look the same. What do we know about positive reinforcement? We know it follows a response when we're trying to increase a response. What do we know about negative punishment? We know it follows a response when we're trying to decrease. What do we know about corrective feedback? Well, for, let's say, running discrete trials, a client engages in a response, a target response, we're going to give them corrective feedback based on the response and what we're looking at. All three of those follow a response. The only one that doesn't is non-contingent reinforcement. Non-contingent reinforcement occurs before a response. Think of non-contingent reinforcement as a motivating operation intervention. We are acting on the MOs to typically decrease or increase value of reinforcement, which evokes or abates behavior. It's the entire idea. So if we think of non-contingent reinforcement as a motivating operation intervention, then it has to be what? It has to be an antecedent intervention because one, it occurs before the response, and two, it's acting, okay, as an antecedent, right? And it's acting on the MO, which is an antecedent, I should say, okay? So which of the following would be considered an antecedent intervention? It's going to be non-contingent reinforcement. Which of the following is considered continuous reinforcement? Now, some people say, well, this question is too easy, right? I need harder questions. And yet the BCBA pass rate is around 60%, which is extremely low. It's because, one, we overestimate our abilities. Two, the exam is hard. And 3, we neglect the easy stuff. Just because you're taking the BCBA exam doesn't mean the principles of behavior change. Our basics are still there. We still need to know the basics. The basics are the foundation, the building blocks of the rest of the material we need to learn. So when you see an easy question, embrace it, right? Use it to your advantage. Take that easy point and move on. But don't neglect the easy stuff when you're studying because you think, 1, it's too easy, or 2, you don't need to know it, because both are false. So which of the following is considered continuous reinforcement? Well, continuous reinforcement says for every response, you're delivering reinforcement. Frequency recording. Frequency recording is a type of measurement, not a type of reinforcement. So we have FR1, FR3, and VR1. Well, VR1 is a variable ratio 1. So on average, we're delivering it on every one response, but not every time. So it can't be continuous. FR3, a fixed ratio 3. Every 3 responses get reinforced, so not continuous, which leaves us with B, fixed ratio 1. Every single response gets reinforcement. We are continuously reinforcing. Which of the following is considered continuous reinforcement? B, FR1. Linda starts programming for generalization. She instructs her RBT to disguise the reinforcement so that the client does not recognize when they're about to receive reinforcement. The RBT is doing what? You have a little giveaway here, right? We're programming for generalization. So start putting on your thinking cap. How do we encourage generalization? In this case, we are disguising the reinforcement so the client does not recognize when they're about to receive reinforcement. We don't want them to anticipate reinforcement because a lot of times in the natural environment, we can't anticipate reinforcement. We have to act anyway. So is the RBT training loosely, using multiple exemplars, using indiscriminable contingencies, or programming common stimuli? Well, ask yourself, are we acting on the stimuli in the environment and the stimuli we're training on, or are we acting on the consequence stimuli that we're using to change the behavior? Or we're acting on the consequence stimuli we're using to change the behavior. We're acting on the contingency, okay? Training loosely, using multiple exemplars, and programming common stimuli all involve altering, changing the stimuli of the environment, the stimuli we're teaching, in order to produce an environment more closely to the natural one. We're not necessarily doing that here, okay? We're altering the reinforcement or the pattern of reinforcement to make it indiscriminable, to make it unrecognizable, okay? So what are we doing? We're using indiscriminable contingencies. All right, thanks for watching. Please like and subscribe. Questions, comments, let me know. I'd love to help. Check out bcbastudy.com for all the study materials. Work hard, study hard. I'll see you soon.